elephantiasis, also known as lymphatic filariasis. The microbe description of the disease is parasitic worms from the roundworm family. Wucheria bancrafti, Brugueria malali, and Brugueria timari are all three of the parasitic worms that are found in elephantiasis. Wucheria bancrafti is the most common. Its body is delicate, which makes it hard to remove from the tissue. Disease mechanisms. W. bancrafti is transmitted by the consecutive bites of infected mosquitoes. Microfilariae obstruct lymph vessels, most commonly in the extremities and outer genitals. Since the microfilariae are blocking the lymph vessels, accumulation of fluid causes swelling. Because of the hyperplasia of the connective tissues of the hypodermis, the patient is susceptible to recurrent bacterial/fungal infections. Skin of the affected areas usually develop a dry, thickened, pebbly appearance like so. Disease pathology. Who is at risk? 18% of the world's population are at risk. Greatest frequency in the tropical regions, Southeast Asia, India, Africa, and South America. It can affect men and women of any age, and people of low socioeconomic status are at most risk for developing the disease. The effects on the community. Elephantiasis comes with disfiguring symptoms that can hinder the ability to work, which then contributes to reduced economic capacity and development. In some cultures, people get ostracized from the society because they don't want the further spread of the disease. Diagnosis. Clinical evaluation through a variety of tests is the way that you are diagnosed with the disease. A detailed history of the patient's clinical history is very important, and identification of symptoms. Disease management. Most cases aren't as severe as the pictures shown. So the general treatment is bed rest, elevation of affected body part, wrapping affected body part with compression bandages, and taking good care of skin and nails. For the more severe cases, dilithocarbamazine is used. It kills the microfilariae and some adult worms. The only side effect is it causes severe fevers, sore throat, and muscle pains. But there's no difference in men or women of any age while taking this drug. The National Institute of Allergy and Infectious Disease solved the complete genome for Bruguiera malali. And as said at the beginning of the presentation, Bruguiera malali is one of the parasitic worms, but it's not the most common. So its effectiveness of eradicating the disease as a whole is not, very effective because W. bancrafti is the most common. World Health Organization treatment/prevention plan. WHO launched their global program to eliminate lymphatic filariasis in 2000 and targets to achieve full elimination in 2020. There's two components to their strategy. One is the large-scale annual treatment of eligible people in an area where infection is present. The second is to help suffering through increased morbidity management and disability prevention activities. By reducing the density of microfilariae in the bloodstream by using albendazole with either ivermectin or DEC, this reduces the number of mosquitoes infected with the parasite, thus stopping the spread of the disease. Morbidity management. Severity/progression can be prevented with good measures of hygiene, skincare, exercise, and elevation of affected limb. Vector control is put in place using insecticide-treated nets, indoor residual spraying, or personal protection. 314.7 million people have no longer require preventative care thanks to WHO's strategies of providing access to care packages for every person with lymphatic filariasis in all areas where the disease is present. And here's some pictures of the most common. This is a child where it's affected his legs. This is an adult where it's affected his legs as well. This is a woman where her hand is much, much larger than the other. And this is a rare case where it's affected the face, because it mainly affects your extremities and outer genitals. Thank you for watching.